Hey guys, Dr. Ben here, Functional Medicine Centers. Welcome. Excited to have you on today. Going to talk about blood work, going to talk about some different tests, some things that you've probably never had done before and what they mean, what they're telling us. So much information we can gather out of the blood work that people are missing. Everybody goes in for their routine blood work every year, or maybe even more frequent than that, but they're missing out on so many different things. So stick with us. You're going to learn a lot about some very unique markers that you need to be running the next time you do your blood work. So welcome, excited to have you on Functional Medicine, all about getting to the underlying why. The root cause of what you have going on, looking at your blood work is the way that we do this. Fort Collins, Colorado is where I'm at. We have Phoenix, Arizona. May, we're going to be opening up in Nashville, Tennessee as well. Excited to have you guys on board. If you've got any questions at all, pop those down below. Anything related to this, other blood work questions, anything along those lines. If you haven't already, like or follow our page, and then also share this with anybody that you know that needs this information. Anybody that you know that's dealing with health issues, that's fighting for their life, that's just not getting life like they want it to be. So my goal, I want people to be more, do more, and give more. Every single day, show up, be the best you can be, and that's what we're looking at here. So welcome everybody. Pop down below where you're watching in from. I've seen Janet and some other people pop up here, but go ahead and let me know where you're watching from. Give you a shout out, and we'll go from there. All right, here we go. So, hey Steve in Kansas. I'm going to go through the specific markers, and then I'm going to let you know exactly what they're telling us and why you need to do those. So here's an interesting one that maybe you've had done, probably about the only reason, oh, and sorry, we're gonna have to flip-flop this again, and about the only reason that you may have had that done is if you were, hey, Andrea in Michigan and Shannon in Del Norte. About the only reason you have had insulin run is that you have blood sugar imbalances and somebody thinks you might have diabetes, something like that. But insulin, we not only want to test insulin, but we want to test it non-fasting. Meaning, at just a random time throughout the day. Most people, hey Heidi, good to see you. Most people are going to be looking at this insulin and they're going to be doing their blood work fasting. But guess what? 12 hours of fasting, you're going to get to the point, hey Claire in Portland, 12 hours of fasting, you're going to get to the point where your insulin is probably okay. So we have to do it non-fasting. Most of the nurses that I work on, I ask them, hey, is that kind of weird? And they're like, yeah, hey Shara, we always do our blood work fasting. Why are you doing it that way? Because I want to see real world, what's actually going on when you're going and eating. I had a lady last week, 220 on her insulin. We wanted about 10. If I see somebody 60, 80, 100, that's really, really high. Lady had 220. If she had just been fasting, it probably would have been 10, 15, 20, something along those lines. So we've got to look at insulin, but we've got to look at it non-fasting. And here is why. So in our cells, we have receptors. Receptors are going to be basically responding to different things. So insulin is going to be a hormone. And hey, Shara, good to see you. Insulin is that hormone. Insulin grabs a hold of glucose. So let's say you eat something, sweet potato, quinoa, Krispy Kreme donut because you just got your vaccine, whatever it is, you get glucose goes up, insulin grabs a hold of it, insulin goes into that receptor, glucose goes into the cell, and we make energy. So that is a great part of this process. Hey, Christy, good to see you down there in Georgia. So we get this energy production, but glucose and insulin are crucial for that. What is the important part here to think about is that receptor. That receptor is going to respond. Hey, Nancy, good to see you. That receptor is going to respond to insulin. So when insulin goes in, it opens the door. But what happens is that receptor gets gummed up, and then the body produces more insulin, more insulin, more insulin, more insulin. So this is the number one way to tell if somebody has what's called insulin resistance. Upwards of 70 to 80% of the population in this country have insulin resistance. Insulin resistance is going to be where that keyhole is gummed up, so then we just keep kicking out more insulin, and that's from the pancreas. So the pancreas kicks out all this insulin. Insulin is very inflammatory. Hey, Jill, see you there in Florida. Hi, Janet. You like the Krispy Kreme donut joke. So the pancreas is still working in a lot of these people, and they're kicking out lots of insulin. Insulin is inflammatory. It's going to throw off our hormones. Women that have PCOS, polycystic ovarian syndrome, have insulin resistance. Men that have andropause, where they are converting their testosterone into estrogen, and that's getting man boobs and all those things, that's coming from that insulin resistance. All of these things need to change. So the way we stabilize this and get rid of this insulin resistance is to keep that blood sugar as consistent as possible. So insulin is a crucial thing to test. You want to be doing that on every blood work you have, but you want to be doing it non-fasting. Okay, so the next thing that we're going to look at that a lot of people are not testing, but we test on every single person that comes in, are the thyroid antibodies. And the thyroid antibodies are TPO and thyroglobulin. So if you go to your doctor, go to your lab, have them run this. Hey, Tracy, good to see you in Phoenix. Question, if you are insulin resistant, why do they give insulin for diabetes? Usually when they give people insulin and type 2 diabetes, they give people insulin, it's because that pancreas has actually worn out. It's not working anymore. And so then that insulin resistance, yes, it's still there, but the body's not producing insulin like it needs to because that pancreas is wore out. So that's when they start injecting insulin externally. Hope that answers your question. I think we had another one here. Hold on. And Steve, oh, good. How do you like the Dexcom, Steve? That's great. We've been looking at some of the continuous glucose monitors, and Dexcom is one of those systems. So that would be great. I'm sure that you're able to gather a lot of information. So one of the things that we've done for years and years is to check blood sugar with a just finger prick blood sugar monitor. Steve was talking about I just don't know what to do with it. Yeah, give us a call. We can help you through that. The continuous glucose monitor is the patch that goes on the arm, and you just use your phone, or it tells you exactly where that should be. So yeah, absolutely. That's a big part of this process, getting that blood sugar stabilized. So thyroid antibodies, these are huge for figuring out what's truly going on with somebody's thyroid. There's over 20 million people in this country that are on levothyroxine. Give me I don't know if we want to do thumbs up or thumbs down, but give me a thumbs up if you are on levothyroxine, or you know somebody, Synthroid, levothyroxine, any of the T4 thyroid replacements, and we're going to see a bunch of thumbs come up there. Guarantee there are people out there listening that are already on thyroid medication. And usually their doctor will run TSH, thyroid stimulating hormone. Here comes the thumbs coming through there. A bunch of you guys are on thyroid medication, and you have seen this TSH. Hey, JL, I take the compound T3, T4. Yep. And so here's the deal, though. Doesn't matter if you're taking T3, T4, whatever it is. If you have these antibodies, you have what we call Hashimoto's. So Hashimoto's is going to be this autoimmune thyroid issue going on, where your body is attacking its own tissue. It's attacking the thyroid. That's the TPO. And the thyroglobulin is actually the bus that transports thyroid around. It's actually attacking that thyroid. So the bus that transports those around. So thyroid antibodies are crucial. You've got to know, is your body attacking its own tissue, and that's why you have low thyroid, or is it because you just have low thyroid and you need thyroid support? So this is a crucial marker. I always joke, you don't have to fly out to Mayo Clinic to get your thyroid antibodies tested. You don't have to go to some special lab, whatever. Quest Quest. If you do cash pay with Quest, it's $14 to do these thyroid antibodies. Let me know, guys, post down below if you guys have had these antibodies tested, and if you did it on your own, or if your doctor did it, or if you had to request and say, hey, run these antibodies. But anybody that has had their antibodies tested, let me know down below if you had that requested and had to push it, because that's where most people are at. So Hashimoto's, is the body attacking the thyroid? Is the body attacking the bus? So you've got to test for both of those. Most people don't even realize there's two types of Hashimoto's. Hey doc, Quest Diagnostics, they're one of the labs around the country there. But so anyways, we can get, and we, even through our lab, it's $10, $15, $20 to run these antibodies. It is not a big deal there. So thyroid antibodies, request that next time you run your blood work, and your doctor will say doesn't matter, but you say it does matter because I want to know if my body is attacking itself, because guess what? If you are attacking your own tissue in one place, over 50% of the time you're attacking multiple. So for people that have Hashimoto's, which is like 80% of low thyroid, you've got to be able to figure out if you're attacking other tissues. Cynthia, don't have a thyroid. Still, even people that don't have your thyroid before or are irradiated, you've got to still test those antibodies, because we see it all the time in people that don't have their thyroid and they still have antibodies, meaning that their immune system is still revved up and they're probably attacking other places. Hey Lisa, good to see you up there in Estes Park. Thank you so much for that feedback. Loved working with you through all these years. Okay, then we get into another marker, ferritin, and ferritin is going to be an iron marker, and not just regular iron. So most of the time people will look at their blood work and their doctor says, oh, your iron is fine. We see iron fine all the time. Iron is just floating around in the blood, how much iron you have at the time. But ferritin is actually the stored iron. So what's actually stored in the system, stored in the tissues. This is a great indicator for potential anemia. We want it 40 for both men and women is the minimum, but if somebody's in the teens to single digits, that is going to be very, very low, very dangerous. You've got to figure out why that is low. So low ferritin, but even though the regular iron is okay, you've got to run the ferritin to see if you're low. But here's the deal. I see high ferritin way more than I see low ferritin. It's amazing. I bet it's 10 to 1. So yes, we do see some anemia, but we see the high ferritin all the time. It's actually the #1 first marker when we get our blood test back. We see ferritin high, and that tells us more about inflammation than it does anything. For women, we don't want that over 125, and for men, we don't want it much over 150. If it is, your body is inflamed, and 9 times out of 10, we're going to see triglycerides high, we're going to see C-reactive protein high, we're going to see blood sugar, insulin, GGT, uric acid, all of these inflammatory processes. So if ferritin is high, if ferritin is over 125 in women, 150 in men, 9 times out of 10, their blood sugar is out of balance and they're having this inflammatory process, even some insulin resistance. Hey Hector, why sometimes people feel chills for no reason or their body gets hot for no reason? Is that a thyroid problem? The temperature regulation can be thyroid, but if it's that hot, guess what? Sometimes we'll have people, they'll have these sweating episodes, especially at night. They'll wake up with this almost hot flash, and that's going to be more adrenals and blood sugar. So what we see is that when the blood sugar dips down, the adrenals get kicked in, and then we've got this fight or flight state going on. So a lot of times if people are having a hot flash, it's actually more of a blood sugar adrenal issue than it is a thyroid or hormone issue. Adri, sorry about the name. I have multiple sclerosis. Should this be on my test as well? Ferritin, absolutely. You should test your thyroid antibodies. If you have one autoimmune condition, you should check your thyroid antibodies as well, because there's a very good chance they are being attacked. Ferritin, absolutely. Every single person should know what their ferritin level is. And Linda, how do you increase ferritin? Well, there's two things. You've got to figure out why it's low, what's causing that, and then you've got to fix it. So in most of the people, it's actually their gut. So their gut is actually having this malabsorption, leaky gut, or they're actually losing blood. If somebody's got H. pylori, irritation, damage in that gut lining, that can be a big part of it. So what do we look at? We've got to stop the damage, and we've got to start the repair. Repair is going to be marshmallow root, aloe vera juice, glutamine, a lot of different nutrients going on a AIP type of a diet, something where you're taking grains out, inflammatory foods. That's going to allow that gut to heal up, but you've also got to stop the damage in the first place. So if somebody has food allergies, if somebody's taking a lot of aspirin, Advil, Tylenol, any of the NSAIDs, if they're taking antibiotics, all those things are going to be damaging that gut lining. So ferritin, we know low is bad, but high is bad as well. Let's do one more here, and then we'll let you guys go for the day. So yes, Linda, we'll look forward to seeing you. So the last one that you want to check on every single blood work is what we call GGT. Let me know if any of you guys have run GGT before, and it's a crucial marker. Again, super simple. It's not some exotic test, anything like that. It's a liver enzyme. Typically, people will run AST and ALT. And this is sad because yes, sometimes these are high, but so many times people miss it. And this is going right hand in hand with that high ferritin, high triglycerides, insulin resistance, high C-reactive protein, another inflammatory marker, all of these different things. So GGT is a crucial marker, and this tells us about fatty liver. We can't diagnose fatty liver off of high GGT, but what we do know is if you have high GGT, very good chance that your body is starting to convert that liver over into what we call fatty liver. Our cutoff is 20, but even the lab, most of the labs is like 40 to 60 for that, and we'll see people at 60, 70, 80, 100 on that GGT. They're converting into fatty liver. In the old days, what was fatty liver from? Anybody know? From drinking alcohol. But guess what? I don't see patients that are drinking 6 to 12 beers a night. What I do see, though, is people that their blood sugar is jacked up. Every time the blood sugar goes up too high, we store glucose in the liver. Every time it goes low, we kick it out. Store liver, over and over and over, and we start getting what is called fatty liver. Andrew, yep, it used to be alcohol, but it is actually now, it's from blood sugar imbalances. It's from these swings. I see people that have perfect blood sugar numbers on A1C and everything in the blood work, but they have fatty liver because they're swinging up to 100 points in one day. Their average is okay, but they're swinging up to 100 points every single day. So this is absolutely a marker that needs to be run on everybody. Costs a couple dollars, not a big deal, but if every doctor ran it, they would be seeing this left and right like we are. And it's pretty scary when you see some of the numbers that come out. But what's awesome is the liver can regenerate, it can rebuild, it can repair. If I needed half of a liver, of your liver, it would grow back. It would grow back inside of you, and it would grow in me as well. Yeah, Messina there. Can chronic high cholesterol cause the GGT levels to increase? I have not seen that. I have seen GGT levels totally fine with people that are 250 to 300 on their cholesterol, even after doing all the work. It is not going to be the cause. I almost guarantee that your blood sugar is not how it needs to be. Hey, JL. Yep, absolutely. So probably 95% of the patients that we see, what do you do for chronically elevated liver enzymes due to sugar? Absolutely. That's going to be 95% of it is going to be due to the blood sugar swings, and not just highs, it's the lows as well, because the liver kicks it out then, stores it, kicks it out, stores it over and over and over again. Yes. Hey, Christy, got a question there. Yes, absolutely. We'll get that list up there. Yeah, it's not going to tell you much. So today, GGT, insulin, non-fasting. So go in non-fasting. Even if they tell you to fast, go in non-fasting. You want to run those thyroid antibodies, and then you want to run that ferritin as well. So here's the deal, guys. You can be so much more healthy. We see it even in the first 30 days of working with somebody. Their energy is up. Their brain is working better. They're sleeping better. Their gut's getting better. They're down 5, 10, 15 pounds. Miracles can happen very quickly. I always say food is medicine, but more importantly, food can be our poison. Food can be our toxin. You've got to put the time and work in, and if you do, you will see miracles just like we do every single day in practice. So we can change a lot of things in our bodies. We can change our health, and you've got the tools, you've got everything. You just got to get that information. Remember, it's not the how that you got to go and figure out the how, it's the who's. You got to have the right who's on your team to get you to the healthy place that you need to be. So drop us a line if you got any questions at all. If you're watching this later and you got questions on any of this information, go ahead and pop that down below. We watch these, keep an eye on these comments down the road. So if you have anything at all, let us know. Linda, good to see you, and you guys make it a great day, and we'll keep cranking these out. Take care.